As local hospitals now continue to treat a steady number of COVID patients, we are hearing from those on the front lines of the ongoing battle. Medically trained members of the U.S. Army Reserve are the latest reinforcements to help the staff at Christus Pond Shoreline. Our Bill Churchwell shows us now what they're doing.
They are the men and women of a medical task force with the U.S. Army Reserve, deployed at the request of FEMA. Their primary purpose is to support the ongoing efforts of treating COVID-19 patients.
This battle is real. The virus is real.
We caught up with the task force made up of about 40 to 50 members right here at Christus Pond Shoreline, where Lieutenant Colonel Sean Holloway says it's an all-hands-on-deck operation.
Our doctors, our nurses, our physician assistants, many of them have been fighting this battle for many months, and not just here at Christus Pond. So that expertise, that ability, that experience, again, helps to increase the capacity of the hospital.
Not only did we need them, but we still need them.
Dr. Osbert Blow is the president and chief medical officer for Christus Pond Health. He says having the beds to care for patients in large numbers is only one component.
You need to have the human resources. That installation was truly a highly skilled, multidisciplinary team that, as one would expect from our Department of Defense.
He says when you count the assistance from the state and the Department of Defense, they have received the help from a staff close to 300 professionals. Blow says they are thankful for the addition of the medical task force team.
In one word, blessed.
And that team is expected to be here as long as they are needed. Bill Churchwell, 3 News.